Do you have a cystocele or prolapsed bladder and you don't want surgery? Have you considered a pessary? Maybe you've never heard of a pessary, or maybe you've tried one and you'd like to know how to make it work better for you. I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. And here we're going to talk about how a pessary can help you care for cystocele. So first of all, what is a pessary? A pessary is a silicone device. I always want to call it a thingy. It's a silicone thing that you wear at the top of your vagina to help hold prolapsed organs in place. So I have some examples I'll show you. We have some different sizes and shapes of them here. Cube, Gellhorn, these big ones, little ones. These are pessaries, so they're kind of stiff, but a little squishy. And if you've ever used a diaphragm or you know about diaphragms, it's just how they work. It kind of pops in at the top of the vagina and can hold your prolapsed bladder in place. So why a pessary? Has loads of advantages over surgery. For one thing, very, very safe. There are a couple things that can go wrong with pessaries, but they're not common. And if something goes wrong with the pessary, you just take it out, where surgery is permanent. You can't just take out your surgery. Pessary, you can just take it out if it's not working for you. Sometimes there can be some abrasion, can cause a little bit of irritation, sometimes bleeding. If you don't care for the pessary properly, you can get bad problems, but you're going to take care of it properly, right? So when you take care of it, most women don't have problems with pessaries at all. Now, one of the problems women do have with pessaries is that they're often not fitted correctly, and I'll talk about that in a second. But I want to talk about the great thing about pessaries, which is that when they are fitted properly and they're working well, it's like flipping a switch that you don't have prolapse anymore. If you are suffering with a prolapsed bladder and it feels yucky and you're not as active as you want it to be, and you just feel like, what happened to me? Who is this with this thing coming out of my vagina? A pessary can bam, make that go away. So it's really, really worth trying. I know sometimes women are nervous about it. They don't want to try it. It's like, I don't want to wear something around in my vagina all the time. But it is so worth trying. And for most women are able to put it in and take it out themselves. So you're in control of whether the pessary is in. Not every woman can do it on her own, but for the benefit of complete relief instantly, it is worth a try. So we could say so much more about pessaries. I want to keep this video a little bit short. To work properly, you need a couple things. You need the pessary to be fitted correctly. Now, not every doctor is going to do that for you. I'm very sorry to say most doctors are not really excited about pessaries because they make a lot more money by doing surgery for prolapse. Pessaries take a lot of office time to do a fitting and to do maintenance. It takes more time than some other things, including surgery, and doesn't pay very well for your doctor. So there's not a big incentive for doctors to work with you to make the pessary succeed. There's a big incentive for you, though, to make the pessary succeed. So if you can find somebody who's willing to work with you, sometimes you need to try a whole bunch of different sizes and styles. You've seen the range, right? See, like here, we have some style differences. And let's look at a size difference. That one's smaller. So here are some of the size differences. You really need the right pessary, and sometimes women have to try a whole bunch of different ones. So one thing is having a care provider who will really work with you to help you succeed. Another thing you really need to succeed with a pessary is the tone of your pelvic floor muscles needs to be good. Your pelvic floor, we're missing a layer of it here. So here's your pelvis, right? Your pelvis. Here's the pubic bone just to get you oriented. Here's the outer layer of the pelvic floor, which is this bowl of muscle here. There's the vagina. There's the clitoris, the urethral opening. This bowl of muscle here needs to be functioning properly in order to help hold the pessary in place. It's the pelvic floor is a big part of what supports the pessary in position inside your body. So if the pelvic floor isn't toned properly, pessary is probably not going to work well. And that's where Kegel exercises come in. Kegel exercises, of course, are exercises for these muscles, the pelvic floor. And by doing Kegels correctly, which 99% of women are doing Kegels wrong, by doing Kegels correctly, you can create a pelvic floor that can really support a pessary properly. To find out more, please visit kegelqueen.com. I'm the Kegel Queen, and I'm here to help.